So
Sure.
there's two versions of the light adjustable lens. There's the LAL and then there's the LAL plus.
Hmm.
I've had patients say, well, obviously I want the plus. That sounds better. I mean, it sounds like the limited edition or whatever it is that makes it, the Grand Caravan. I want the grand part.
Of course.
But it's a bit of a misnomer. So I'd love to kind of discuss a little bit about what decisions go into or what factors go into the decision about which lens to choose and how, in fact, the plus isn't really a plus. It's an option for some patients that is maybe a good choice or a better choice, but is definitely an option where the regular LAL or the standard LAL is in fact the much better choice. So let's kind of dive into that a little bit.
Yeah. Good question. So I almost wish that they had named it something different,
Oh,
LALA versus LALB, right? They are more alike than they are similar. They're both fantastic lenses. They both have the same qualities and characteristics that we have known to, appreciate with the light adjustable lens, and that it can be adjusted 3 times. We have the same amount of range. The only real difference is a subtle change in design with the LAL Plus. You mentioned before that the LAL is not simply a monofocal lens. It's a monofocal lens with a certain degree of asphericity. And asphericity, it sounds like a bad thing, but it's really a good thing. What it does is it provides just a little bit of depth of focus, and that aids in our ability to keep the eyes teamworked together while providing a little range of vision up close. So the LAL plus, at least theoretically, is a little bit more aspheric, which means that it provides a little bit more depth of focus. And so what we find in clinical practice when we do a target, we're sacrificing one eye just a little bit at distance to give it more up close. We call that blended vision. Think of it like monovision. A lot of people have probably had monovision where one contact is set for distance, one contact is set for reading. This is like that, not as extreme. And we preserve binocularity and depth perception that way. So the LAL Plus, we find that we don't have to separate the two eyes out by as much. It provides a very comfortable binocular version of vision with really good reading. Now, if we have that lens, why wouldn't we just use that for everybody? Of course, it's like the iPhone 17. If you're going to get an iPhone, get the latest one, of course. The reason we don't use it for everybody is because every eye is just a little bit different. If we have a lens that's a little more aspheric, we need to make sure that our corneas are pristine. We need to make sure that, patients who have had prior refractive surgery, their corneas have been permanently altered. We want corneas in our clinic, at least based on our judgment, that have not had surgery. People with severe dry eye, people who might have macular degeneration or glaucoma, anything that might compromise your vision even just a little bit, we don't find that we need to really make that jump because in those cases, the LAL works just fine and it provides as good of a visual outcome as the LAL Plus in those scenarios without any risk for things like glare or halos or contrast loss. Not that that's a common thing, but again, in surgery, we're trying to control every single variable that we can. And this is just one variable that we control. Typically, I mean, John, I don't know, we don't really talk about it to patients a whole lot. We just kind of say you're a candidate for X or Y, and we go that route, right?
well, it comes back to like make the recommendation that will provide the best quality of care. Now, of course, there's Dr. Google, right, or Dr. Perplexity. I mean, but patients, and we expect that. And patients who are looking at this and they're making an informed decision, at least by looking up what's out on the internet and what's available. And so patients will come in saying, "Well, there's two different choices. What is the? Why are you choosing one versus the other?" So it's a conversation that comes up if we're asked, but quite honestly, what we want to do is provide the best quality of care. We want to provide the best quality of vision. It makes for a very happy patient. It provides what are patients asking for? They don't want an LAL plus. They don't want, what they want to
Mhm.
see better. I mean, it's just so fundamental. Let's not get, too tied up with the nomenclature of what it's called, but let's talk about what is the vision that you want to achieve. And that's at the end of the day, that's really all people care about.
Right. It's the outcome. And so we definitely I don't shy away from those questions when somebody asks me about
Yeah.
it because I think we have very good reasons. They cost the same. There's no difference in anything. It's just me as the physician, us as the physicians, we want to make sure that you as the patient are set up for success. We have no incentive to leave anybody dissatisfied. I mean, that just creates headaches for us. We want to have everybody as happy as possible. If we think that we can achieve the best result with the LAL instead of the LAL plus, that's the route that we're going to take. And we get questions all the time on it, which is totally fine. And I think we have a very good answer for why we would do one over the other. But it does come down to specific anatomy and specific physiology. It comes down to your specific eye, the way it's built, the way it's designed. And if you have specific questions, I definitely would encourage you to ask your doctor about why maybe. There was a question that came in about a scenario where somebody was implanted with the LAL, but was curious about the LAL plus. There's probably a specific reason why the LAL was chosen, not the LAL plus, and it may come down to just your own physician's experience. Dr. Vukich, is there any difference in surgery between the LAL and the LAL plus?
Zero. We can't even tell which one it is. I mean, you can't tell just by looking
Yeah.
which lens it is. So they handle identically. They're used identically from a surgical standpoint and from a patient perspective standpoint. They are completely interchangeable. You cannot tell the difference.
Yeah, the only way that I know is the serial number.
Yeah,
It's just a one
exactly right.
digit change in the serial number,
Yeah.
but otherwise you would really have no idea. You can't tell. We even look at our aberrometers. An aberrometer is a way to measure high order optical qualities, and there's really not a whole lot different that you can tell based on the numbers. Again, it's just one added variable. If we can control every variable, we're going to take advantage of that. That's just one extra variable.